For the refractive lens exchange, we usually perform the procedure at an outpatient surgery center. By the time that the patient comes into the surgery and the time that they leave, I would say it's going to take about 3 hours. So when the patient comes in, they usually sign paperwork and then the pupils are dilated, and that can take 30 to 40 minutes. The surgery itself is done sometimes with laser, sometimes it can be done manually. And the surgery, the cataract surgery itself really just takes about 10 to 15 minutes. Then the patient is taken to the recovery area, and I would say it takes about 15-20 minutes before they are sent home. The procedure is usually painless and it's very comfortable. We do have an anesthesiologist at the surgery center that provides IV sedation and just anesthesia, which relaxes the patient. And we usually, the numbing of the eye is done with eye drops. And so the patients are very comfortable. Most patients don't have a lot of recollection of their surgery. Some do have minor memories of different steps of the surgery, but it's usually a very pleasant and relaxed experience. Patients are usually very happy. With regards to the recovery after surgery, most patients can go back to work after a day or two. I usually like to recommend the patients take off the day of the surgery and then the next day in order to make sure that they are comfortable in order to return to work or whatever their activities are. The eye drops that we recommend usually they're used for about 3 weeks and are usually a combination of an antibiotic and 2 anti-inflammatory drops. The visual acuity returns usually within 2 or 3 days. It is normal for the eye to feel a little irritated, a little scratchy, a little teary for a day or two, and the vision can also be a little blurry for a day or two, but then usually by day 3 or 4 it's usually pretty clear and patients are usually very happy.